Welcome back to Alabama News Network. This morning it's Wednesday, so that means we're being joined by Dr. Kathy Lindsey. She'll take your calls right now if you have a healthcare question. 1-800-504-4084 or 420-TALK. Dr. Lindsey, thank you so much for being with us. As always, we appreciate it.
You're welcome.
So we've got our Tickle Pink Expo coming up, and it's helping raise money for the Joy to Life Foundation, which is based right here in Montgomery, which is for breast cancer awareness. We want to talk a little bit about breast cancer and kind of what the signs are, how you can kind of self-check and stuff like that.
Yeah, breast cancer is very important. 1 in 8 women will have breast cancer. It's the second most leading cause of cancer deaths in women. So it's very important to get our screens and get self-breast checks, that type of thing. Mammogram's the #1 gold standard for screening. People do breast self-exams, and it's recommended, physicians are recommended to educate people about it. And it's best to start early when young girls come in for their first check, to tell them about breast tissue, because breast tissue is normally lumpy and bumpy, and women don't want to check it because they don't know what they're feeling. But if you start doing that once a month, mid-cycle, not right when you're on your cycle because the breast tissue is more lumpy then, but you get used to what's normal. And I tell people, if they have something that they're worried about, come and let the doctor take a look at it and then check it.
All right, what are the standards for mammograms? Because I know that they've changed recently. It used to be 45.
The U.S. Preventive Task Force recently changed the recommendations to people 50 and older every 2 years, but most physicians still go with the old guidelines that the American Cancer Society use, American College of Physicians, and ACOG, which is the OBGYN Associates, and they still recommend yearly at age 40, and 70% of physicians out there are still adhering to that.
Now, what if you have someone in your immediate family?
Well, if you have a first-degree relative with breast cancer, you need to start screening 10 years younger than when they had the cancer. So if they had cancer at 40, you need your first mammogram at 30.
Okay, and what does that mean? Does that mean your grandmother? Or
no, it means your mother or sister or sibling, like that.
Okay, so getting those mammograms is definitely something important. Now, you want to talk a little bit about this gene that has been very popular in the media recently.
It's called BRCA or BRCA. Angelina Jolie had the bilateral mastectomy due to having that, and that's very rare. Less than 1% of the people have that gene. It's not recommended for screening in everyone, but if you have that first-degree relative with the gene or that has had breast cancer, you need to consult your physician and get counseling before you get the lab work drawn, and then discuss with them about what measures you want to take.
And again, you want to stress that this is very rare.
It's very rare. Less than 1% of the population have that gene, so it's not meant for everyone to go out and just ask for that test.
All right. And as far as doing a self-exam, quickly tell us what we're looking for there in general terms.
Unusual lumps or bumps, notice skin changes, if you have any dimpling, if you have nipple discharge, any unusual redness or heat or edema noted about the breast tissue, let the physician know that. If you have a lump that doesn't go away or swelling under the arm, those things need to look at that.
Dr. Lindsey will be at our Tickle Pink Women's Expo that's coming up on October 1st. We're going to have lots of other vendors there, and you'll be able to talk to people and give them information on this if you have questions about it. And she also owns Alabama Laser and Wellness Center, and she has a practice there. So there's her number, their Alabama Family Practice, if you'd like to get in touch with her. Dr. Lindsey, thank you so much for being with us. We always appreciate it.
Thank you.
Coming up next on CBS 8 and ABC Montgomery, Ryan's back with a look at your full forecast, and an upcoming fashion event is trying to prove that bald is beautiful. We'll have that coming up.